Hi, I'm Dr. Soraya, and in this installment of Comments on Psych Meds by a Psychiatrist, I'm going to talk about paroxetine or Paxil, which is another medication in the class of medications known as SSRIs or selective serotonin reuptake inhibitors. As I have mentioned in my other videos about this class, they're usually referred to as antidepressants, but in addition to both mild and major depressive disorder, they can be used to treat a variety of anxiety disorders, including panic disorder, generalized anxiety disorder, and others. The dose range, immediate release Paxil, is generally started at 20 milligrams, can be started lower at 10. And then controlled release Paxil, the milligrams are a little bit higher. So I think for the comparison to 10 milligrams of regular Paxil, I think is 12.5 of controlled release. And I'm not sure what the top range is, and I'll get into the reason I'm not that familiar with it in a few moments. But that's the main indications are for depression and anxiety. So actually, the main reason that I'm not that familiar with the top range is that I don't prescribe a lot of Paxil. I have a handful of patients who came to me already taking it, and they had good effect, so we maintained them on it. But I will generally not start a patient on Paxil, and that's because coming off of Paxil can be very, not difficult in the sense that it can't be done, but it just has a very tends to have a very profound withdrawal effect. So for some patients in particular, it can be a process to get them off the medication. And then in situations where they run out or they miss doses, it can be very uncomfortable. It has a very uncomfortable withdrawal phenomenon associated with it. It's pretty notorious for this detail. I would say along with venlafaxine or Effexor XR, probably medications with the most significant withdrawal effect. And the withdrawal is not medically dangerous, but can be so uncomfortable that, as I said, I tend not to start patients on this medication, and will not push the dose and kind of to the high end of the range. Also, another reason that I don't prefer Paxil is that by reputation it tends to be a bit higher on the side effects. So both with a tendency to cause weight gain as well as fatigue, which are definitely two significant side effects that we're trying to avoid when choosing antidepressants or anti-anxiety medications. So it can be an effective medication. I definitely have patients who have benefited from it. As I said, started on it with another doctor and who have come to my practice. So I think it is a good medication, but I think because we have alternatives that don't have the same issues with certain side effects and with withdrawal, I think that for that reason we tend to stay away from it. But if you're already taking Paxil and in particular having a decent response to it, there's no reason to go ahead and try to switch on to anything else, because you'll then have to go through the process of coming off of it, which you may eventually decide to do anyway. But I don't think the warnings about the withdrawal are reason enough to switch to another medication. So if there was anything helpful in this video, I hope that you will consider following me and my channel, and thank you for listening.